Hello and welcome to a special edition of Our Voices. I am Oriane Itangishaka. On today's show, we'll hear from African women who are using technology to better their lives and their businesses. It is part of an exciting new multimedia series called Startup Africa, co-produced in cooperation with our affiliate partners, Channels TV in Nigeria, City TV in Ghana, KTN in Kenya, NBS in Uganda, and RTV in Rwanda. The series focuses on tech startups across Africa. But what is tech startup? And how do you make it work? Here's what some people told us.
Startup, for me, I understand it's where you want to start up a business. You come up with a plan, an idea, maybe where you want to have your business and what you want to do.
So startup is like when you are starting your business or an idea that you have and you want to put it in practical way.
Definitely you have to address a particular need. You have identified your market and you've seen a niche, so you have to bring into your startup to fill that gap.
The startup phase is when you have dreamt of an idea to be able to solve a certain solution in the community. You bootstrap the process, and then you get to the point where you have a viable product or a viable service that you're showing to people. Once you're making an impact in the lives of people, you're solving a specific problem. That, for me, it's just the beginning as a startup.
Uganda technology and skill consultant Ruth Musoke Benzika has some of the answers.
For anybody to have a very successful startup, first of all, you must have the vision, the courage, and the ability to know that you fall, but you can raise up. If you don't have that, it doesn't work. Because, if you're starting up something, you are beginning from scratch. You're trying to reinvent something that probably has not been done before, and a number of times you're going to get people who will tell you it will not work. Some will tell you it is not possible. Some will tell you it is not of this time. And it means that you really need to have that strength to say, this is what I want. You need to be able to see far more than what other people can see.
Catherine Karimbo Gichungi had the courage to say yes. The Kenyan entrepreneur launched her startup, Raid and International, to help people in the informal sector better advertise their skills and find more work. Here's her story.
Redund Directory is an application that is available on Android and enables informal sector to be seen on the internet space. It's an application that delivers all skilled workers, both informal and formal sector, onto the internet space. So they're able to be seen on the internet. Data is bigger than oil. It's what will enable us now build an informal sector bank that enables us alleviate the problem of the betting and the loans and all that. And when we are looking at employment, we'll be able to source and enable counties to solve the problem of unemployment, because we have a business model that targets both employing the informal sector and also building the jobs as we speak. So right now we don't know how many nurses in our county in Nairobi. We don't know how many electricians are in Westlands Market in Kamukunji. We don't know how many people are panel beating the pans. We don't know, but this platform will be able to give us that information and that data to help them better, give them loans, and data is everything right now for the government.
I've been Radiant Directory from around 2015. I choose to go to ladder, just open the phone, open the app, then Google what you want and get the assistance.
So working in Nigeria, I met several other people. There was Dangote, there was Dr. Micah Denuga, I worked with Dr. Chris Kirubi. I could see them coming from humble backgrounds and making it big and impacting the society in a very, very big way. I'm trying to use technology, and I'm not telling them to self-register or download an app. They have no time, they don't have the kind of phone, and they don't have the money for data. So I'm going to them. I've devised a way from what I learned from my time in Safaricom and M-Pesa to be able to use that know-how to go out to the villages and form a network of agents that bring the informal sector to the internet space. So for you to become an agent, you have to have the passion to go out there and have the passion for the informal sector. So our agents are created on the back end of our system. So there's a business model. We are able to structure the fees. So we started with $2 to 200 shillings, so that is shared within the agency structure. So we recruit you, for example, and you become an agent. So you are an agency, and you are able to add 50 school Form 4 leavers under you, up to 100 if you like. So that creates instant employment, and it's Africans to change Africa. It's us Kenyans to do something. So I'm just doing something.
I work for Redant as an agent. My work basically involves going to the street, looking for new service providers. We register them so that they can acquire more customers through our online platform, that is Redant Directory. So far I've been able to register 7 people. If I'm registering a customer, that is a service provider, you just pay 200 bob, which goes to the company through the pay bill, and that's all. You'll never pay anything else.
I want to join Redant Directory now so that I can spread the tattoo art. I choose Redant Directory just to spread, to get more market. I've interacted with some of the people on the directory of Redant, and the feedback was good.
Funding is not, it doesn't come easy. So I've funded using my other consulting services. So if once I get some money, then it goes into funding the building of the code. Redant Directory is not yet profitable, so hopefully we will be a big brand. But everyone is trying to get into the informal space right now. We have a saying at Redant Directory: the fact that Ronaldo is a very good football player does not stop Messi from playing.
It's time to take a break. When we come back, we'll go to Kenya and talk to a female entrepreneur about how her insurance startup has changed her life despite the financial hurdles and organizational stress of her new business. Stay with us.
Being part of Our Voices is about more than just sitting here and talking about women's issues. It's about listening to them
And bringing their opinions to the table and making sure their voices are heard.
Because our lived experiences, our stories, and our voices will help shape the next generation.
Welcome back, you with Our Voices. When Ines Maina launched the Kenyan insurance startup Bismarck, she learned that being an entrepreneur changes your life. Despite the financial difficulties of starting any new business, she says that her approach to life is now simpler. Let's look at her startup journey.
When I got into insurance, I discovered there's a lot of friction between insurance companies, insurance agents, and customers. And every day I kept asking, why, how can we reduce this friction? Because customers would complain. I get to know that I was not covered when there's a claim. And the insurance, from their point of view, they have given all the information through a policy document. So I needed to understand what is the real problem. Most of the young people have their income is not consistent. So how do we enable them accept insurance as a risk mitigation solution to their financial issues? And also, how can they access it hassle-free, conveniently, and at the comfort of their mobile phone?
Working with Bismarck, I think I've loved their services. I don't get to deal directly with the insurance company. I deal directly with Bismarck, which makes my work so easy because I just need to sit back and they'll handle everything else. We're in the digital era, we are in the 21st century, and things can be done in a better way. Things can be done in an easier way. So you find that if we have the startups that are bridging the gap, then it just works out very perfectly for the rest of us, yeah.
The problem we are solving is actually in the insurance sector. The penetration of insurance in Kenya is very low. And actually in Africa, apart from South Africa, most of the African countries, the insurance penetration is very low. Now, when you look at the demography of Africa, we have a very young population. You know, median age, 19 years old. And the insurance has been selling the same old products, the same way, same distribution channels, but then it means they cannot access the current customer. My lifestyle has changed. It has become simpler and easier. You see, when you're employed, you're a bit extravagant. Because you see, you know that every month there'll be more money, and so you can spend as much as you can because there's more money coming. And of course, the things that drives you when you're employed are different from what drives you when you're an entrepreneur. When I was quitting my job, I thought that when you quit job, you need a big office, many employees, so that then that's a measure of success. Look at today, I think different. It's how lean can I scale my business? How can I scale my business without increasing my costs? So those are the things that I look at. One of my biggest challenges was the funding. When I was quitting my job, I had estimated that my savings would last me for 2 years. And before the end of the year one, the finances were over. Yeah. The other challenge was, you start this journey, you need a team, you need people who will believe in this dream, not because you're paying them a lot of money, but because they are here, they believe in your vision. And in 10, 15 years, we hope to have democratized insurance. When I say democratization of insurance, whereby it's an open market that anyone can get in and get, whatever products they want. And how we do that is that we're building an infrastructure that will be able to connect customers and insurance companies and, existing African social groups and institutions to all be able to pull their risks together. Our expenses were quite high. So I would lower the cost of running the business, start small and with the customers, designing with customers one by one without thinking of before scaling. I think the first one was to quit my job. That was very important. There is no worse decision. Yes. Because even that decision has really taught us a lot. So I would say, for me, it's not about whether the decision is good or bad. It is a decision has to be made at the time it needs to be made. My mantra is, whether it is right or wrong, make the decision. You will learn the lessons as you progress.
Launching a startup often means finding investors who are willing to fund your vision. Here's what consultant Ruth Musoke Benzika had to say on some of the challenges facing young innovators.
A number of times when you're starting a business, and tech basically falls in there, it's very hard to find somebody who's going to finance a startup business. It's so hard. There are very few people who are able to do that, but there are people who are able to say, okay, if I find a very good idea, I can be able to put in some money, buy shares in the company. I can be able to there are some, they call them business, they are angels that are willing to say, okay, yes, angel investors, I'm able to invest in such a business. Sometimes it could be from your family. If you're a young person into tech and you go and talk to your brother and talk to your mother and say, mommy or daddy or brother or cousin, this is what I want to do, but I need you to give me a hand up. Give me some money to start. They are willing. Young people don't have a lot of capital. They have not yet built a lot of networks. And a number of times we are saying, start with a small core team. So we advise young people, startups, start lean, start small. Start small, but knowing where you want to go. The moment the business keep on growing, keep on filling the core strategic areas and the core positions for your business.
Uganda entrepreneur Hilda Asimo says the core goal of her startup Digital Health Access is to improve African healthcare in bringing patients closer to doctors through a digital health network. Here's her story.
My name is Hilda Asimo. Digital Health Access connects health service providers and professionals to patients through a mobile phone. What patients have to do is go on the app, check for any doctor they want to talk to, and consult or book an appointment. I actually started it in 2013 because of my mother. My mother developed a rare disease, started swelling all over the body. So we went to see a doctor. But the doctor gave us some painkillers, but the lady was really in pain. The whole night she was groaning. I searched the whole of Google, but I couldn't get anything. So it came to me like, what if I had these doctors, as many as possible, on a platform where I could chat with them? I woke up one morning and I quit my job. And I got a developer who I sat with in his house for the next 48 hours until the website was up. So that's how I started Digital Health Access.
For a unit like mine, which is a specialist unit, it's not a general unit, it's not like people walk in all the time. We want Cornerstone to be seen over the whole country. And even in our sector in Uganda, health is not advertised. We can't advertise ourselves. Then there's this Digital Health Access, which comes in that we can link patients to the specialists and that means also it brings in the issue of trust, that maybe the patients trust Digital Health Access to do all the due diligence on the facility, on the specialist, so that when the patient goes through Digital Health Access, he knows I'm going to get value for money, I'm going to really see someone who's a specialist and not a crook and what. And young people have a challenge, they fear hospitals. It's very hard to see a teenager just walking. And sometimes they suffer with these diseases and they don't know whom to talk to. This is the time to use the app.
Accordingly to our analytics, Google Analytics, actually more of our visitors are between the age of 18 and 28. So, and according to our analytics still, the most questions are asked about sexual reproduction. So I think we are more helping the youth in this case, because they're the ones who normally shy out to ask these questions in institutions. So they look at us as the easy solution. I think the most challenge is spending every saving I've ever worked for the last 30 years on this company. We put almost everything. I even sold my car that I had got from my previous work. It gets tougher, but the good thing is that every call from a client makes it worthwhile. Every time you have a hospital registering and someone telling you we have an appointment, it makes it worthwhile. But as a company, success is when I have every small clinic, every small pharmacy, deep village accessing digital health access to anyone, even those that cannot afford a mobile phone. I would love to have a system that connects the whole health system in Africa in one place. And I'm very sure in the next 5 years, we're going to be having the most interactive health forum. We're going to be having the most visited site.
Asimo says she learned the hard way about starting small.
The hardest decision I made is to fire my 7 salespeople. The next day I came back to office and I was all alone. It came back to the same way I'd started. When I fired them, I didn't want it, but I had to because I couldn't pay them anymore. It was the hardest. Actually, I was even thinking of taking a loan so that I can keep them on the team, but one great man said a company can never be run on a loan. I had to move at least like the next month, 3-4 months, until the landlord had to lock me out of my own office, where I spent almost 10,000 to brand. So now I'm working on the streets. So I have to meet these people in hotels. It has actually made me stronger. I've never been more passionate about this business like it is after they have locked me out. Actually, like, this lady does not know what she's doing when she was closing me out. I was like, I'm going to be the most important person in the next 3 years. And I may even buy this building one day. I know it is not easy, but vision never dies.
It's time to take another quick break. So do you know of any startup business on the continent that we should be keeping our eyes on? If so, let us know on Facebook, Instagram, and WhatsApp. The number is right there on your screen. Our handle online is at VOA Our Voices. Use the hashtag VOA Our Voices so we can find your comments. After the break, we'll take a look at how coronavirus pandemic is impacting entrepreneurs. We'll be right back. Welcome back. You're watching Our Voices. The ongoing coronavirus pandemic is changing all of our lives. Here's how the virus has impacted some of the entrepreneurs in our Startup Africa series.
Man, it has hit us hard. COVID has put everyone in a very difficult situation.
Never experienced anything remotely so cataclysmic.
Transport tech startups have been affected negatively.
I'll say the biggest thing that is frightening is the uncertainty. There's a huge level of uncertainty. We are seeing how people are responding. We don't know when we see the next wave.
The economic impact of the COVID-19 pandemic is still unclear. And that uncertainty is bad for capital markets.
The business is, since the lockdown, it's been lower than, it's been on survival mode.
People are fearing health facilities because they think they might actually be at risk of getting COVID-19.
We are obviously uncertain times, but they've brought our company closer and our team closer together and forced us to really focus on what is important.
It's very important for you to have your own courage to say, yes, I'll make it no matter what. And even when I fall down, I'll raise up and walk and move ahead.
While most companies are losing business during the pandemic, analyst Ruth Musoke-Benzika says tech flexibility gives it a greater adaptability.
For me, I think that COVID has actually created a lot of opportunities for people in the tech sector. You can see that people are now more open to online meetings. Instead of coming to meet, people are able to go online and meet. People are more accepting to technology before, at whatever ages. You are now seeing more people who are able to say, okay, instead of going to a market, I would rather go online on an app and I'm able to order what I want.
The co-founder of Nigeria's Helium Health, Tito Ovia, says coronavirus is having an uneven impact across Africa startups.
We've seen from the healthcare tech industry like I'm in,
There have been many innovations, many telemedicine solutions, contact tracing solutions that have come up to be able to help and fight the pandemic. However, fintech companies have actually suffered, during this point in time, as a lot of them make their money through, businesses and processing their payments and aviation. Agritech as well have also suffered in the time because, again, can they really now be able to reach the farmers that they need to? So it really depends on what tech industry you're in. Healthcare, honestly, I would say is booming, but we might find that definitely others have been suffering.
For Ines Maina, the economic impact of COVID-19 is reducing demand for insurance through her Bismarck startup.
The year had started very well until when the lockdown was announced. We actually had to close our office to cut on costs so that we can keep the business on survival mode. And insurance is luxury. We saw a decline in number of people who are buying new policies. So basically we were maintaining the old customers, and some of them had to downgrade just to cut on the cost. However, it should be the other way because people need to protect themselves against the risks that face them. But that was not the case.
Ruth Musoke Binzika says innovators prosper by aligning startup strategies with changing market conditions.
For innovators, this is your time. Use COVID to innovate. Come up with solutions. If you have a very good solution, I am sure you will always find a funder. Importantly, keep your integrity. Once you have integrity and you have a good innovation, the sky is the limit.
That's our show for today. Thanks to our Startup Africa co-production partners, Channels TV in Nigeria, City TV in Ghana, KTN in Kenya, NBS in Uganda, and RTV in Rwanda. Look for the whole Startup Africa series on the station broadcasting VOA programs, including this station, or visit our website, voanews.com. Thanks for watching Our Voices. I'm Oriane Itangishaka.